Has just stepped up to the patio, really talking about the importance of child health care and access to that care. You can consider this sort of a victory lap the governor is taking for getting his budget passed for the next 2 years. Let's take you live to University Hospitals and Ohio Governor Mike DeWine.
About what is going on. Just met a young man who has been treated for sickle cell. One of the changes that we made in Medicaid several years ago that we thought was very, very important and that we announced is changes that would allow Medicaid to pay for what today is a very expensive procedures in regard to sickle cell. The young man we talked to is free. He's working free of sickle cell. He's working today, going to school. So this is really where the future is. And Rainbow Babies and UH are doing a phenomenal job and really leading in this particular area. So I wanted to see that. I want to have the opportunity to talk to this young man. It was quite a amazing story, and frankly a very, very exciting story. So this is something that we announced several years ago we were doing in Ohio. We are blessed to have research hospitals that are able to do this, and UH is really doing it, and we're very happy about that. So happy to respond to questions about UH, or we have the experts here, as you know, and they will take the tough questions, and if you have any other questions, happy to. I just mentioned that Fran and I are happy tonight to be in attendance along with several of our grandchildren and one of our sons to see the Superman show, and we're really excited about that, and excited to see different locations featured in Cleveland and some from Cincinnati as well. I had the opportunity last summer to, along with several of our grandchildren, to see some of the filming that was occurring. So we're excited about that. It's a good showcase for Ohio. It's a good showcase for Cleveland, and it's something that's very important. We continued in this budget funding for the movie credit. This is frankly how we get shows like movies like Superman here, and some people may ask what the advantage of that is. Frankly, it's one more way to showcase Ohio, one more way to showcase what a great state this is. So more than happy to answer questions.
Where will you be watching the movie at?
We will be at the Great Lakes Center and be there at 7 o'clock tonight and watch it. So we're excited.
Do you get popcorn, candy, and soda, or what do you do?
Well, popcorn is always high on my list. So yeah, Fran can tell you that. So yeah, we generally get the big buckets. So. Yeah. It's a working hospital, guys. Yeah. I'll go back to the answer. Yeah, let me answer the question. The question was about what Senator Hughes did and something I said about him. He was instrumental in having language in the budget that grandfathered some of the assistance that we get through Medicaid. It's quite complicated how it's done, but some of the assistance we get through Medicaid that goes to our hospitals. And Rainbow Baby is one of those, UH is one of those. And frankly, without him, I don't think that would have been in the budget. So the budget passed. Virtually every Republican voted for it. But what he did before it passed was absolutely instrumental to the state of Ohio. And to have somebody there who understood Medicaid, and not only understood Medicaid, but understood how it impacted in Ohio, and what assistance it is to our hospitals was very, very important. If you want, I'm sorry. Look. This I wasn't there to vote on it. we, as governor, I deal with the hand that we're dealt. But, we already had, for example, a working requirement that we put in and asked the federal government to approve. We think that makes sense. This will not go into effect for some time, but when it does go into effect, we would certainly hope that we would not see that people would be able to comply, and we would not see a loss in people. But so this is, again, I want to say with Senator Houston, he made a huge contribution, but for him, frankly, this would not have been good for our hospitals. Yeah, I'm sorry. I got you back.
No, I understand that you were dealing with a health. I spoke to hearing yesterday a medically complex child concerned with medically
Look, I am not in the United States Congress. I was, and I was for 20. Could I answer the question first, please? The bill is a complex bill. What I do as governor of the state of Ohio is try to give the best care. We work very hard every single day for the large number of people who are on Medicaid in the state of Ohio to see if they get the best care. We will continue to do that. We will do everything we can to keep people on Medicaid so that they get the services that they need. It's very important, and I'm proud of, frankly, what we have done since I've been governor of the state of Ohio in that area. Who else?
Governor, I know that there could be some impacts to Medicaid after the bill that was signed by President Trump on the 4th of July. Is there any concern from you on how that could impact people here in Ohio?
Look, we're working to try to implement every single part of it. There are changes in Medicaid. There's also changes in SNAP, for example. One of the things that we're doing in regard to SNAP is to take the actions that are needed to reduce the error rate. One of the things that they provided in this bill in regard to the SNAP payments, the food payments, is a additional cost to the state based upon the error rate. And so the action that we're going to take is these errors are generally made, frankly, down at the local area, in the county level. Frankly, an error can also be if the individual did not report something correctly. So those are very difficult for us to control. But we're going to put in more technology, pay for that technology, so the error rate will go down, and that will lessen what the state has to pay. So that's one of the things that we're looking at today, and one of the things that we will be doing in the very near future. Who else?
Completely unrelated, but can you comment on the lawsuit about the complaints fund being used upon the grounds don't see
Well, we have courts, and we have people who have the ability to go into court and file lawsuits. The thing that I wanted to make sure in regard to the proposal about the Browns, I wanted to make sure this did not just take care of the Browns. I wanted to make sure that other stadiums, frankly, all over the state, and other sports here in Cleveland would be able to be covered. I felt and continue to feel that we should not be spending general fund dollars for sports stadiums and general fund dollars that compete against education. So the proposal that came through from the legislature, I was comfortable with, because it does not provide money coming out of the general fund. It also enables us for the next several decades at least to be able to help fund sports stadiums all over the state of Ohio, and to do that again without taking money away from education or taking money away from mental health. And so that's why I signed the bill, and I thought it was a good resolution of that. As far as any kind of lawsuit, people have the right to go to court, and that's why we have courts, and that's why we have judges, and they'll make their decisions. So. So I did issue a number of vetoes. The legislature may come back and vote on some of those, as many as they want to vote on. You know, this is the process. You know, we have a division of responsibility. We have checks and balances, and they have every right to come back and make their decision. What we announced, I think just about an hour ago, I think the release went out, is a working group, and that working group is focusing on the big picture and the big problem that I hear about every single day. And the problem I hear about every single day is might be a couple 70 years of age. They paid off their mortgage on their house, but they live in an area where the valuation is going up very, very quickly. And now they're in a position that the real estate taxes are so high that they can't live in the house anymore. That's a problem. And so I put a working group together. I've given them 60 days to come back with some real results and some real recommendations. And I think what's important in those recommendations is that we help the people who are on a fixed income, that we help people who are seeing their property tax rates go up very, very quickly and very, very fast. We have to give them some relief. At the same time, we have to balance this so that we continue or are able to fund our schools, where property taxes go, our fire departments, our police departments, all the other local money and services that are provided. And so it's a good group. We announced the two chairs. I have great faith in both of them. Both of them have served in the legislature before. We're going to add additional names later today that we'll be announcing. So we look forward to getting those results back and then acting on that. I'm sorry. Well, again, it's a balance. In Ohio, we pay for our schools really primarily in two ways. One is through local real estate tax. The other is through the state funding. If you live in an area that is a poor area, then the more money comes in from the state. If you live in a more affluent area, then less money comes in from the state. So we try to work that out. The goal, I think, should be that we do have the adequate funds for the schools, and so that's what the goal is, and that's what the goal is of this working group, and we'll see what they come back with. Look, my job as governor of the state of Ohio is to do everything I can to make sure that all Ohioans can live up to their God-given potential. And we do that. And one of the ways we do that is to make sure that Medicaid is covering people and is helping people. And we have a director who I'm very, very proud of, who works very, very closely with our hospitals, and we will continue to do that. I am the governor of the state of Ohio. I'm not the United States senator nor members of Congress, but we work very closely with them. And again, it was that communication, the communication from UH, frankly, that was very helpful. Cliff called me on a Saturday, I guess it was, and said, we got a problem. And so I then got on the phone and called Senator Houston, and Senator Houston, frankly, got it fixed. So that's the type of cooperation that, frankly, is very, very important. It's the close relationship we have with the hospitals. You have my cell phone.
Yes, sir.
So he had my cell phone. He called me. I called the senator. The senator then called him, and those conversations went on all weekend. That's the type of close cooperation that, frankly, is just vitally important to the future of the state of Ohio, and that's what I focus on. So, anybody else?
As far as those cuts to Medicaid, obviously, when it happens at the federal level, there's only so much you can do. But is there a game plan that you have when you think about places like East Cleveland, where the poverty level is so high, and now maybe health care is off the table for them, but they're living right down the street from big places like UH, Cleveland?
Yeah. Look, first of all the stories about the projections are only that at this point. So we don't know how these changes are going to really impact the number of people who are served. So we will continue to examine that. We will watch how this is rolled out, what the regulations are that come out of the federal government that back up this bill. You have the laws passed and you have the regulations. And frankly, we will continue to do everything we can to make sure that all Ohioans get good medical care. And again, it goes back to my basic principle. We have to do everything we can to make sure every Ohioan can live up to their full potential. And good medical care is an essential part of that. We are blessed in Ohio to have amazing hospitals. Northeast Ohio, we certainly do, and we do throughout the state. And we have some amazing children's hospitals as well. We have more children's hospitals in Ohio, I think, than virtually any state in the union. So we work with them. And frankly, I rely on them to tell me what they are seeing and if they're seeing a particular problem. But until we see that, and until that plays out, I can't react to that. We can try to get in front of it as much as we can if they see something coming. So we have to follow the federal law. We have to follow whatever regulations they put out when they put them out. But we also then have to administer that locally, and we have to administer it in Ohio. And our goals have never changed, and that is to provide medical care to people and to provide the best care that we can. And Medicaid plays a major, major role in that, and will continue to play a major role in that. So, anybody else?
Governor, what's it mean for you to be here today at the Children's Hospital?
What's it mean? I'm sorry.
What's it mean for you to be here today?
Yeah.
And what brought you here today?
Yeah, look, I'm always inspired when I go to any of Ohio's children's hospitals. We are blessed with these hospitals. They do amazing work. They work miracles every single day. Fran and I have had the experience of taking our own children to Dayton Children's Hospital, for example. We've seen our grandchildren go to children's hospitals, and as a parent, now as a grandparent, there's just nothing that you worry more about than your child who has a medical problem, and you're bringing them in. And thank God we have hospitals like Rainbow Babies, and we have the other children's hospitals in the state. So it's for us, I think, for Fran and for me, it's a kind of an emotional time anytime that we walk into a children's hospital, because you see the kids, you see the families, you see a child in there waiting to go in. You see them in the lobby, and you think, I wonder what's wrong, and you think, what if that was my child? And so, yeah, it's a very emotional time for us. Okay, thanks everybody.
Thank you. It was so nice to meet you.
Thank you.
You got the hard question.
I got it.
We're doing no rules.
So you're going to the game?
Yeah.
I'll take care of it.
Okay.
Good to see you.
Good to see you. I'll see you at the end of the month. Yeah.
Thank you.